From New York City, the epicenter of the pandemic, this is Democracy Now!
I've been very worried ever since hearing news of the coronavirus infection in the Rohingya camps. There is no end to the worry.
A major cyclone hits India and Bangladesh amidst the pandemic, displacing 3 million people and unleashing heavy rain on Cox's Bazar, home to 1 million Rohingya refugees, where the first cases of COVID-19 have been confirmed. We'll go to Bangladesh for the latest from the United Nations High Commission for Refugees, and we'll look at the coronavirus threat to millions of refugees in camps across the globe, where social distancing is often impossible and health care extremely limited.
It is worse than war because during war you know who your enemy is, but now you don't know where the disease is going to come from the air or from a person.
Then a new report finds 1 million children under 5 could die the next 6 months from secondary impacts of the pandemic, like disruptions to health services and access to food. Mothers are also imperiled. We'll speak with the lead author of the report from the Johns Hopkins School of Public Health and with an infectious disease pediatrician. All that and more coming up. Welcome to Democracy Now!, democracynow.org, the Quarantine Report. I'm Amy Goodman. The World Health Organization's Director General warned Wednesday the COVID-19 pandemic has reached a grim new milestone, with worldwide confirmed cases of the novel coronavirus topping 5 million.
In the last 24 hours, there have been 106,000 cases reported to WHO, the most in a single day since the outbreak began. Almost 2/3 of these cases were reported in just 4 countries.
The United States tops the list by far, with over 93,000 deaths and over 1.5 million confirmed cases. The U.S. has the 9th worst fatality rate in the world, right next to Iran. Russia has the 2nd highest infection rate, with over 300,000 reported cases. Brazil, which recently surpassed the United Kingdom to become the 3rd most affected nation, has emerged as the world's largest coronavirus hotspot. In Brazil's Amazon region, the mayor of the hard-hit city of Manaus accused the government of far-right President Jair Bolsonaro of intentionally allowing indigenous communities to die of the disease.
Eu temo genocídio.
I fear genocide, and I want to denounce this to the whole world. We have here a government that does not care about the lives of indigenous people. It is a crime against humanity that is being practiced here in my state, here in my region.
In the United States, Columbia University disease modelers reported Wednesday that if states had begun social distancing measures just 1 week earlier in March, 36,000 fewer people would have died of the coronavirus. The Columbia report came as ProPublica revealed how different responses to the growing outbreak in San Francisco and New York City led to a stark difference in death tolls between the 2 cities. San Francisco started to take action as early as January and was the first major city to issue a shelter-in-place order beginning March 17th. Mayor London Breed shared the text of the order with New York City Mayor Bill de Blasio, but New York Governor Andrew Cuomo dismissed de Blasio's initial idea of closing down the city and waited until March 22nd to shut the city down and the state. By then, the virus was rapidly spreading across New York. The estimated death toll in New York City now stands at nearly 21,000. In San Francisco, just 36 people have died from coronavirus. Meanwhile, Republican political operatives have begun recruiting pro-Trump doctors to make television and radio appearances to promote the case for reopening states' economies, even where they failed to meet safety benchmarks set by the CDC. This is Republican Party strategist Nancy Schultz speaking in a leaked audio of a conference call obtained by the Center for Media and Democracy.
There is a coalition of doctors' coalitions who are extremely pro-Trump that have been preparing and coming together for the war ahead in the campaign on health care. And these doctors could be activated for this conversation now.
Protesters left mock body bags outside the White House Wednesday as part of a national day of mourning to condemn the Trump administration's handling of the coronavirus outbreak. Some protesters held signs reading, "Trump lies, people die." Cyclone Amphan has battered East India and Bangladesh, killing at least 22 people, destroying thousands of homes, leaving millions without power. It's the strongest cyclone to hit the region in over 2 decades. The storm unleashed heavy winds and rain on Cox's Bazar, the world's largest refugee camp that's home to 1 million Rohingya refugees living in crowded and often unsanitary conditions who fled to Bangladesh from Burma. After headlines, we'll go to Dhaka to speak with the UN High Commissioner for Refugees. And in London, we'll be joined by the president of the Burmese Rohingya organization, UK. Michigan's facing a potential environmental disaster as floodwaters from 2 breached dams threaten the headquarters of Dow Chemical and nearby Superfund toxic cleanup sites. Dow has used the Midland, Michigan complex for decades to produce saran wrap, styrofoam, Agent Orange, mustard gas, and other products. On Wednesday, Dow acknowledged there were floodwaters commingling with the on-site toxic contaminant ponds at its facility. Dow's complex also houses a small nuclear reactor used for research. The New York Times reports Dow filed an unusual event report with the Federal Nuclear Regulatory Commission overnight, citing the heavy flooding. The crisis in Michigan began Tuesday when a pair of dams breached after 2 days of heavy rain. President Trump's intensifying his attack on mail-in voting by threatening to cut funding to the swing states of Michigan and Nevada, where officials are attempting to make it easier for residents to vote by absentee ballot due to the pandemic. In a series of tweets, Trump accused the states of acting illegally and promoting voter fraud. Trump's tweets came a day after Michigan's Secretary of State Jocelyn Benson tweeted, "No voter should have to choose between their health and their vote, and every Michigan citizen has a right under our state constitution to vote by mail. With funding from the Federal CARES Act, I am ensuring every registered voter has the tools to conveniently exercise that right," she said. Public support of mail-in voting is high across the country. One recent poll showed 3/4 of Americans support universal access to mail voting. The Labor Department releases its latest unemployment figures today, with economists estimating another 2.5 million U.S. workers filed jobless claims over the last week. The total number of newly unemployed people is rapidly approaching 40 million, a level not seen since the height of the Great Depression. Hundreds of McDonald's workers went on strike around the country Wednesday, demanding the fast food giant take full responsibility for the safety of workers and customers during the pandemic. This is Aisha Townsend, a Chicago McDonald's employee on strike for personal protective equipment, paid sick leave, health insurance benefits, and hazard pay.
I'm doing what I feel is best for me and my family due to the COVID-19 situation. I want to be able to protect my family, but I also want to be able to protect my coworkers around me when I have to go to work. So I just want McDonald's to make sure that workers like me, you say that we are essential workers, protect me and my beautiful boys and even my friends and family that are around me.
In New Orleans, sanitation workers are in the 3rd week of a strike, demanding $150 in weekly hazard pay, PPE, repairs to trucks, and a wage increase. The company contracting with New Orleans to pick up garbage, Metro Service Group, has brought in work-release prisoners as temporary replacements. The prisoners are being paid less than the minimum wage. This is one of the striking workers speaking at a picket on Tuesday.
I have 7 kids. I'd be scared to play with my kids some days I go home. I got to stop my daughter at the front door. Tell her, Daddy, you can't jump in Daddy's arms right now. Daddy can't give you no kiss. I'm scared I'm going to get sick.
The United Food and Commercial Workers reports at least 68 grocery store workers across the United States have died from COVID-19, and more than 10,000 have fallen ill from the disease. The Ford Motor Company temporarily shut down assembly plants in Dearborn, Michigan, and Chicago, Illinois, after workers tested positive for coronavirus. The shutdowns came just days after General Motors, Ford, and Fiat Chrysler began a phased reopening of their U.S. factories. President Trump is traveling to Ypsilanti, Michigan, today to tour a Ford auto plant that's been converted to produce ventilators during the pandemic. Ahead of the trip, Michigan's Attorney General said the president has a legal responsibility under state law to wear a mask during the visit, after Trump refused to commit to wearing one. Immigrant rights activists are condemning the deportation of Hector Garcia Mendoza, a 30-year-old Mexican immigrant who sued ICE, that's Immigration and Customs Enforcement, just last week. Garcia Mendoza was part of a class-action lawsuit demanding the immediate release of all immigrants held at the Elizabeth Contract Detention Facility in New Jersey, where prisoners and staff have tested positive for coronavirus. He was transferred to Texas Tuesday, then deported to an undisclosed location in Mexico. His attorneys say they have not been able to find him. Garcia Mendoza's removal came despite a federal judge's order blocking the deportation. Advocates believe his expedited deportation is retaliation for the lawsuit against ICE. In Alvarado, Texas, 11 immigrants imprisoned at the Prairie Land Detention Center have filed a class-action lawsuit against ICE demanding their release after at least 45 people at the for-profit jail tested positive for coronavirus. The prisoners say ICE is continuing to transfer immigrants to other jails across the country, risking the spread of COVID-19 from one ICE jail to another. In Arizona, 14 immigrants held at the Florence Detention Center near Phoenix have started a hunger strike to protest dire conditions inside the privately owned ICE jail. This is one of the Florence hunger strikers.
There are 14 people infected here, and they have been sent to the hole. The sick ones are sent to the hole. We started the hunger strike today. The time to stop will be when they release us in boxes. They will have to take us out in boxes because we no longer believe in them.
The United Nations Middle East envoy has called on Israel to abandon its plan to annex parts of the occupied West Bank.
The continuing threat of annexation by Israel of parts of the West Bank would constitute a most serious violation of international law, deal a devastating blow to the two-state solution, close the door to a renewal of negotiations, and threaten efforts to advance regional peace and our broader efforts to maintain international peace and security.
On Tuesday, Palestinian Authority President Mahmoud Abbas declared an end to security cooperation with Israel and the United States and said all agreements between Palestine and the two countries are now null and void. And the University of California announced Tuesday it's completely divested its $126 billion portfolio from all fossil fuel companies. The move makes UC the largest university system in the United States to meet a core demand of activists fighting the climate crisis. And those are some of the headlines. This is Democracy Now!, democracynow.org, the Quarantine Report. I'm Amy Goodman in New York City at the center of the pandemic, joined by my co-host Nermeen Sheikh, who's also here in New York, but staying at home to help stop community spread. Hi, Nermeen.
Hi, Amy, and welcome to our listeners and viewers around the country and around the world.
Well, I certainly, Nermeen, can't wait until you're sitting right next to me and we can do this show together here.
Either.
But right now, we're going to turn directly to Bangladesh. The most powerful storm to hit Bangladesh and India in 20 years made landfall Wednesday, displacing 3 million people and killing at least 20 as COVID-19 cases in the region continue to rise. Cyclone Amphan flooded streets and destroyed homes with more than 100-mile-per-hour winds throughout the night. The storm weakened as it traveled across the coast of Bangladesh, but still unleashed heavy wind and rains on Cox's Bazar, the world's largest refugee camp that's home to 1 million Rohingya refugees living in crowded and often unsanitary conditions. The climate change-fueled storm came just days after the first cases of COVID-19 were confirmed in Cox's Bazar. In a statement released last week, Dr. Sharmin Jahan, Save the Children's health director in Bangladesh, said, quote, "Now that the virus has entered the world's largest refugee settlement in Cox's Bazar, we're looking at the very real prospect that thousands of people may die from COVID-19. There are only an estimated 2,000 ventilators in all of Bangladesh, serving a population of 160 million. In the Rohingya refugee camps, home to nearly 1 million people, there are no intensive care beds at this moment," she said. Well, for more, we're going to the capital city of Bangladesh, to Dhaka, where we're joined by Steve Corliss. He's the representative for the United Nations High Commissioner for Refugees in Bangladesh. Also with us in London is Tung Kin, who is Rohingya activist and president of the Burmese Rohingya Organization UK and a member of the Free Rohingya Coalition. Born in Burma, but in 1982 rendered effectively stateless along with 1 million other ethnic Rohingya under a new nationality law. We welcome you both to Democracy Now! Let's begin in Bangladesh. So you have 1 million Rohingya who fled from Burma to Bangladesh, now being hit by these two catastrophes. One is the cyclone, and the other is the pandemic. Steve Corliss, can you talk about what's happening right now? Steve? Steve, can you hear me? Okay, we'll try to go to Steve.
No, I think, is it better now?
Yes, Steve, we hear you. Steve Corliss,
okay, I'm so
thanks so
sorry for the
much for
technical
joining
difficulties.
us. Can you respond to what's happening right now in Bangladesh?
Yeah, so as you said very well, I think it was an emergency with another emergency layered on top of it. And I think we've been quite fortunate in the last 24 hours that the impact of the cyclone on the camp was limited. It passed quite far to the west. Catastrophic impacts for Indians and Bangladeshis living in that region. But only in the camp we experienced limited flooding, the destruction of maybe 100 shelters, and the displacement of 400 people. So we were well able to respond to it. But now we have to get back to the hard business of responding to the COVID-19 pandemic.
Could you describe, for those who don't know, what the conditions in Cox's Bazar are? What are the conditions there, and what are the concerns about how COVID-19 may spread? It was only last week that the first two confirmed cases, were reported.
So, you know, we have a population of 860,000 refugees living in just over 20 square kilometers. That's equivalent to the population of Bhutan. And the other thing to understand is where they're living was a forest reserve in August 2017 when they first came to the country. And from that forest reserve, an entire city has emerged. But the crowding is remarkable. The population density is twice what you'd find in Manhattan. And we have to meet all of their needs. They're living in very fragile accommodation, I should also say. That's why we worry when cyclones come into the area, because they simply will not withstand high winds. But in addition to building houses, we have to provide everything for them: water and sanitation facilities, healthcare facilities. And now, with the demands of the COVID-19 pandemic, we're racing against time to establish specific dedicated isolation and treatment centers for the Rohingya refugees and the local Bangladeshis who need it.
Tun Khin, if you could join us from where you are in London. You're president of the Burmese Rohingya Organization UK. You've just heard Steve Corliss on the ground in Bangladesh. What are your major concerns? And for people to understand why this massive refugee camp, the largest in the world, is even there to begin with.
I think we need to look at why these people are there. The first thing is these are genocide survivors. Burmese military and government systematically for many decades, destroying our community. And in 2017, there is about more than 800,000 Rohingya fled. So today, I think whatever happened here is quite responsible by Burmese government. And we appreciate Bangladesh government giving us shelter. I think there is much more need to be done. I mean, like aid groups and Bangladesh government, they are trying whatever they can. We really appreciate it on that. But, in Bangladesh, they are living a kind of a squalid condition. And, this COVID-19 is a big danger. Another one on top of that, this cyclone, we can see that it's not much attack to their Bangladesh refugee camps. Is much more hit to the Bengal, like Kolkata and others. So our deep sympathies to families and to the victims also. We are worrying that a bit now. After this cyclone, there will be much, there is hygiene, there is no sanitation proper there, and a lot of difficulties of health issue will be rise up where we are facing the pandemic COVID-19 there, same time.
Stephen Corliss, in addition to what you've already described as the conditions in Cox's Bazar, as well as what Tun Khin just said, The Bangladeshi government has also reportedly cut off access to the internet in Cox's Bazar. And it's also now reportedly very difficult to get SIM cards, to get cell phones for Rohingya refugees there. Could you explain why the Bangladeshi government did that and what the impact of that has been on letting people in the camp know about the risks of COVID-19 and what they should be doing to protect themselves?
Thank you. Thank you for the question. The Bangladeshi government explains the basis for the policy as security concerns relating to the cross-border drugs trafficking trade and other factors in the camp. But it does create difficulties for the humanitarian operation and also for the Rohingya refugees on the ground. During a cyclone, for example, we need to be able to communicate with our teams in the field. We also need the refugees, who are actually the backbone of the humanitarian response. Refugee volunteers do virtually everything, particularly in a crisis situation. They dig out people who are caught in landslides. They find children who are separated from their families, and they put them in touch with the international actors on the ground. So the lack of telecommunications is a barrier and is a constraint for us, and we do advocate for the restoration of the internet within the camp.
The United Nations outgoing chief human rights monitor for Burma is calling for an investigation into allegations, Steve Corliss, of ongoing war crimes and crimes against humanity in Burma's Rakhine and Chin states. Can you talk about what's happening with the Rohingya who are left in Burma right now? What we're talking about, something like 600,000?
Yeah. Well, I think the first thing to know about the situation on the other side of the border is there's already an ongoing armed conflict that doesn't directly involve the Rohingya between the Arakan Army, which is an insurgent force representing Rakhine Buddhists in that area of the country, fighting against the National Armed Forces. And the Rohingya in that area tend to be caught a bit in the crossfire there. UNHCR has an office in Mongdao. We work on both sides of the border because UNHCR's job is to protect refugees, first of all, to let them come to Bangladesh and make sure that they're able to remain here until it's safe for them to go home, but also to work on the other side of the border to create the conditions so they could go back to the place they lived in the past. And this is the first and most important thing to understand about every refugee is that, and I think Tunkin would agree with this, that ultimately they would want to be home and be safe in their own homes in Rakhine State in Myanmar when that's possible.
Tunkin, in addition, you said, of course, it's true that the Cox's Bazar has been spared the worst effects of this cyclone, but soon there will be the monsoon season in Bangladesh. And can you explain what the effects of the monsoon have been in Cox's Bazar and what you expect to happen if there have been any safety measures put in place since last summer?
As far as what we know, normally, monsoon landslides and shelters been destroyed. The way how the camps were built up, there is not a kind of proper structural way. So that's it's a big danger normally, and also, the landslide can kill many people. As far as what we know, there is thousands of people are still risks of that landslides risks. So that is one thing we have to keep in our mind. And we appreciate Bangladesh government and UNHCR and other aid agencies, whatever they can, they are doing their best. But I want to bring up here that international community have to do much more to support Bangladesh and aid agencies to improve the situation. So Bangladesh have heavy population. Bangladesh alone, they can't tackle. We appreciate they giving us shelter, and but still Bangladesh could do a lot, lifting up internet access and others that could be very important, and also allowing them to get to medical, hospital, and others. That is very important. But we need to point out the international community should do more. Rohingyas are one of the most vulnerable peoples on the earth. That is critical condition now, COVID-19 pandemic, and we are looking at coming up monsoon rainy season. and already Amphan storm gone away just yesterday, and many things can happen in very few days. This is very important that international community should do much more. We appreciate international community concern, but have to act seriously, not only supporting Bangladesh and supporting aid to Bangladesh and Rohingya refugees. Same time, international community should focus on pressuring Burmese government to restore the rights of the Rohingya, to protect them. Genocide is still ongoing in Burma, where 600,000 Rohingyas' lives are still at risk in Burma. So we need to look at Burma is one of the most brutal military regime, and the government, they are continuously doing it. That's what we need to look at also same time.
Toon King, we want to thank you so much for being with us. Rohingya activist, president of the Burmese Rohingya organization in UK, member of the Free Rohingya Coalition, born in Burma, but in 1982 was rendered effectively stateless along with 1 million other ethnic Rohingya under a new nationality law. And we want to thank Steve Corliss, speaking to us from Dhaka, Bangladesh, the UN High Commissioner for Refugees representative in Bangladesh. When we come back, we'll look at how the spread of coronavirus is threatening the health and safety of tens of millions of refugees in camps and outside of camps across the globe. Stay with us. Destination by Nadine Shah. This is Democracy Now!, democracynow.org, The Quarantine Report. I'm Amy Goodman with Nermeen Sheikh as we look now to the spread of the coronavirus across the globe and how it's threatening the health and safety of tens of millions of refugees from Bangladesh to Syria to Greece to the U.S.-Mexico border. After weeks of warnings, COVID-19 cases are emerging in refugee camps where social distancing is often impossible and health care extremely limited. Last month in Lebanon, a woman at a Palestinian refugee camp tested positive for the virus. In Greece, hundreds of asylum seekers, many from Africa, have contracted COVID-19. For the estimated 5.6 million Syrian refugees in Lebanon, Jordan, and Turkey, the threat of coronavirus also has led to a crisis of hunger, with the UN estimating 70% of refugees cannot afford food. This is a Syrian refugee, Abu Abdallah, speaking along with his wife, Abdallah, from a camp in Lebanon's Bekaa Valley.
In the last few months, coronavirus has been worse than the war.
At the beginning, during the war, it was not like this.
It is worse than war because during war, you know who your enemy is. But now you don't know where the disease is going to come from the air or from a person. War is easier. You know it is the person over there.
Well, for more, we're going to Oxford, England, where we're joined by Dr. Miriam Orcutt, Senior Research Fellow in Global Public Health and Forced Migration at the Institute for Global Health, University College London, and Executive Director of Lancet Migration. We welcome you to Democracy Now! Can you start off by just giving us the scope and scale of the refugee crisis in the world? A tall order.
Thank you. Yes, well, we know that currently the levels of forcibly displaced populations, that includes refugees, internally displaced, and others, is that the highest levels ever recorded by the UN. So 70.8 million people around the world have been forcibly displaced. And actually, the highest number of those are internally displaced people, those who might have been forced to flee their homes from conflict, from violence, or from persecution, who may be displaced multiple times within their own country, even before they flee across international borders.
And Dr. Orkut, as we mentioned in the introduction to the segment, 70% of Syrians, of course, Syrians constitute the largest number of refugees in the world. 70% of Syrian refugees in Lebanon report that they can't afford food. If you could talk about that. And also the fact that a large number of Syrian refugees are not only in Lebanon, but also in Turkey, which has seen a large outbreak, a significant outbreak of COVID-19, even though now cases are reportedly declining.
Yes. For the Syrian displaced population in all the countries surrounding Syria, the context of COVID-19 has been a huge challenge and burden. Not only do many of them still live in informal settlements, so a lot of them, even after 7 or 8 years, are living in tents. They don't have access often to livelihood opportunities, so they can't provide income for their families. And so they're often dependent already, even pre-COVID, on humanitarian aid and food provision and even running water provision from outside. They're not able to be self-sufficient. So you can imagine in both Lebanon and in Turkey that people who are living in tents beside each other in very crowded and cramped conditions, who often share one toilet or one running water tap between many families, will have a real challenge to prevent the spread of COVID, but also just to maintain a basic standard of living during this public health crisis. And one of the things that we've seen, which is across the world, but definitely within the countries surrounding Syria, is individuals who were already facing poverty now not being able to afford food, as you mentioned in your previous report, and not being able to provide for their children.
Go to a report from Reza Adib, an Afghan journalist and refugee locked down in the Malakasa camp outside Athens, Greece. He investigated conditions in the camp for the BBC.
The camp is in quarantine for 14 days. No one is allowed to go out and no one is allowed to come in.
Mr. Karimi has just tested positive. Together with his family and friends, he's told to quarantine in this disused schoolroom. With no taps or shower inside. They say they have to share with their neighbors. They're not happy. It risks spreading the virus.
Look, the people with coronavirus, you see how close they are? For all of us, including those with coronavirus, there is only one tap.
That report from the BBC. In one building in the camp, 23 families live together and 7 people in the group tested positive for COVID-19. Adib spoke to Greek Migration Minister Notis Mithrachi about the findings.
This has not been reported to us by the International Organization of Migration that manages the Malakasa camp. They haven't told us that there is such a problem. I'm very happy you are raising it. We will check.
Dr. Orkut, if you can talk about what's happening there in the refugee camps of Greece and where people are coming from and what Greece is doing.
Well, the interesting thing with the response to COVID-19 in Greece has been that they have had quite a early lockdown for the whole of the country. However, although they have low cases among the general population, for the refugees and asylum seekers who are both in camps on the mainland as well as on the Greek islands, the conditions within which they are quarantined and have been quarantined actually for a longer period of time than the local community, the conditions are very substandard. So on the islands, for example, in Moria camp, on Lesvos Island, in just this one camp, there are individuals, over 1,000 unaccompanied minors. There are vulnerable people such as the elderly and those with underlying comorbidities who aren't able to shelter or self-isolate themselves in order to prevent COVID-19. And they're also, if they did become unwell, the real concern is that they wouldn't be able to access healthcare facilities. Their access to health services is very much restricted, and there are limited capacity anyways for hospital beds and for intensive care beds. Many of these individuals who have fled to Greece might have fled conflict situations from Afghanistan. There are also individuals who have fled from African countries. And what we're concerned about is that ultimately, if there are even a few cases within the camps, which are already very overcrowded, that there could really be quite a rapid and devastating spread, which could potentially go unnoticed and unknown at first, because there really isn't a big enough testing strategy going on underway in the camps in Greece. And what we need to see at this stage would be a massive scale up in testing for all of the populations within the camps, even when there are just 1 or 2 cases, because we know that COVID spreads even among those who are asymptomatic.
Well, Dr. Orcutt, along those lines, I would like to ask about one of the most critical factors that determine the extent and speed of the spread of coronavirus, and that is, of course, population density. We know very well we're broadcasting from New York City, which was and has been the epicenter of the outbreak. But in these refugee camps, New York City has a population density of about 10,000 people per square kilometer. But by comparison, according to the International Rescue Committee, Cox's Bazar in Dhaka, Bangladesh, which we were speaking about in our earlier segment, in Cox's Bazar, the density is between 40 and 70,000 people per square kilometer. And in the Greek islands, which you were talking about earlier, in some camps in the Greek islands, a population density is even higher, up to 200,000 people per square kilometer. So could you talk about that specifically, and what camps present the most risk for the spread of the virus?
Of course, as you mentioned, population density is a real concern. And in Greece, one of the camps which is of most concern is Moria camp, which is the biggest refugee camp in Europe, where there are 20,000 people in a space which would only have a maximum capacity for 2,700. And why that is a concern, particularly for the camps where people might be living in tents, is that if multiple families are living within one tent and they're sharing the same toilets between hundreds of people, then they're not able, even if there is one person who becomes infected with COVID, they're not able to self-isolate effectively. They're not able to protect themselves, but also they're not able to protect others, including their family and the broader community. And similarly, with the very high densities and the informal tents that individuals are living in Bangladesh, in Cox's Bazar, really the concern is that a lot of these protective measures which we take in countries where we have the privilege to be able to isolate and protect ourselves, they just will not be able to take. And beyond that, there are also more vulnerable populations within those camps. For example, the elderly, those who might have underlying conditions, or children who really would need to, at this stage, be protected even more and have a way of being shielded so that they don't experience the more severe complications which we know do occur in those populations. So the real concern is that already the conditions are predisposing to a greater impact and a more rapid spread of COVID. But also, I do think that there are in the region, for example, in Bangladesh, there are many poor populations who also face challenges. And there is an argument for improving the health care system and the numbers of hospital beds and the intensive care capacity for all of the population during COVID, which will ultimately improve and help the overall public health response for all of the populations as well.
Very quickly, as we begin to wrap up, Dr. Miriam Orcutt, if you can also talk about deportations from the United States to places like Haiti and to Guatemala. You have refugees who are being deported who are COVID-19 positive. Some are calling the United States the Wuhan of the Americas. If you can talk about what this means for the Americas, and also jailed migrants. What about the conditions of jailed migrants? Now we have migrants around the country who are on hunger strike. We have the former ICE director, as well as so many human rights groups, calling for ICE to release the detainees.
Yes. I mean, there are calls at the United Nations level and have been for a number of months around immediate release from detention due to on public health grounds, due to the fact that a lot of the conditions within detention or reception facilities, likewise within jails, are very overcrowded and often unhygienic. And there really is a great risk that individuals who are deported during a public health crisis and the current pandemic are being deported to countries which have much weaker health systems and may not have an effective response in place. So again, the call from public health organizations is to suspend deportations. There shouldn't be deportations to other countries, and also the detention facilities, if they are being used, they should be either at least the basic overall condition should be improved, but we are very much calling for release on public health grounds. And there are other community mechanisms that have been proposed by the UN that governments can use.
Well, we want to thank you so much, Dr. Miriam Orcutt, Senior Research Fellow in Global Public Health, Forced Migration at the Institute for Global Health, University College London, UCL, and Executive Director of Lancet Migration. When we come back, a new report's out finding 1 million children under 5 could die in the next 6 months from the secondary impacts of the pandemic. Also, mothers imperiled. We'll speak with the scientists who led the report and an infectious disease pediatrician. Stay with us.
Destruction of civilization's past is consequence of poor respect. Yeah, we from the trees. What goes up must come back down. What goes around comes back around. The things you do be done unto you. Sometimes it's hard to ease my mind to realize you're always with me, waiting, willing to hear my prayers, my hopes, my dreams, my every need. I pray for light in times of darkness. So long, Babylon shall fall. The things you do shall be done unto you.
Country Road by Paula Fuga and Jack Johnson is part of the Kokua Festival 2020 in Hawaii, live from home. This is Democracy Now!, democracynow.org, the Quarantine Report, as we are all alone together. I am Amy Goodman with Nermeen Sheikh. As more than 3/4 of the world's children live under stay-at-home orders amidst the pandemic, a shocking new report finds the child mortality rate could increase for the first time in more than 60 years. More than 1 million children under 5 could die over the next 6 months, according to researchers at the Johns Hopkins Bloomberg School of Public Health, who studied the secondary impacts of the coronavirus outbreak, the disruptions to health services and access to food. More than 60,000 mothers could also die. The report was published in The Lancet Global Health and looked at 118 low- and middle-income countries. For more, we're joined by the lead author, Tim Robertson, assistant scientist in the Department of International Health at the Johns Hopkins Bloomberg School of Public Health in Baltimore. Also with us, infectious disease pediatrician Dr. Beat Kampman, who is director of the Vaccine Center at the London School of Hygiene and Tropical Medicine, lead vaccinology researcher at the MRC unit, the Gambia. We welcome you both to Democracy Now! Tim Robertson, let's begin with you. Talk about the findings of this study, to say the least, deeply alarming.
Mm-hmm. So we know from past experience and research that in outbreak situations, people have health issues because of the virus, but also more people have health issues and complications because of the secondary effects of the outbreak. So in the current pandemic, people are dying because of coronavirus itself. But if the pandemic and the response to the pandemic lead to the disruption of health services, then more people are going to die from other causes as well. So in our study, we looked at the potential for additional deaths among pregnant women and young children. And we modeled 3 different scenarios looking forward of different severity. So in our least severe scenario, over a period of just 6 months, we could see around 12,000 maternal deaths, so women dying in childbirth, and around 250,000 child deaths. These are children under the age of 5. That would represent a 39% increase in child mortality above what is currently occurring. But in our worst case scenario, we saw that up to 60,000 maternal deaths and up to about 1.1 million children could also die.
Tim Robertson, could you explain what essential services, health services, you suggest ought to be retained to diminish the possible mortality rates among women and infants? What are the procedures? What are the health services, the medicines that should not be diverted to deal with a coronavirus, or at least there should be sufficient amounts available for routine care of mothers and infants?
Mm-hmm. So in our study, in our modeling efforts, we look at what we call the continuum of care. So looking at from antenatal care among pregnant women through to care around childbirth for mums, postnatal care, and then looking at care for newborns, for early children. So, for example, vaccinations, preventative care or curative service for children if they have pneumonia or malaria or diarrhea. So in general, I think we see 2 ways in which these secondary effects of the pandemic could impact children. So the first way is, as I said, around health service disruption. So, ordinarily, if a family has a young child that's sick, they may go and seek care from a health facility and get care. So if they have malaria, might get antimalarials or antibiotic for a cough or pneumonia. But under the pandemic, perhaps people are not able to travel to a health facility, or they might be disinclined to go. Perhaps they're afraid of going to health services. And also, even if they were to get to a health facility, perhaps at the facility there's now maybe fewer health workers because some health workers have been diverted to work on the COVID response, or maybe health workers themselves are sick, or perhaps at the facility there's not the necessary treatment, drugs, medicine, because of issues to do with the supply chain. Health facilities just now not having the drugs that they need. So that's the first general way in which we see this happening. And another big general way that we see, particularly for child mortality, is an issue that was touched upon in your previous segment, which is the potential for increased undernutrition, malnutrition, because of broader macroeconomic effects. So, for example, households now not having the same income that they had, disruptions to food services, people not being able to access markets and get the necessary food for their children. And what comes from that is that we're going to see more families living in food insecurity, and potentially more children being wasted, so being undernourished. And while wasting itself doesn't necessarily kill many kids, what it does do is it increases the likelihood that a child will die from other diseases, other infectious diseases. And in our model, that second pathway, these broader effects, increasing food insecurity, increasing undernutrition, is also a big potential way in which more children are going to die because of the pandemic.
I wanted to bring Dr. Beate Kampmann into the conversation, speaking to us from London. If you can talk about the poorest countries in the world right now, I mean, even in the United States, the wealthiest country, it's the lowest vaccination level as parents are afraid to bring their kids in to the doctor. But if you can talk about countries around the world, the stopping of their immunization programs, what's happening and what are the places? One of your specialties is the Gambia, but talk about everywhere from Mexico to Africa's most populous country, Nigeria.
Yeah. Thank you very much, Amy, and thank you for having me on the program. This is really an important topic, and Tim has already spoken about a whole range of services for mother and child health. So I'll try and focus a bit on the risk of the prevention of potentially deadly infectious diseases, for which we know we have vaccines. So I was quite alarmed when I saw the WHO announcing at the end of March that mass campaigns should be suspended, because we know that this will potentially leave over 100 million children at risk of measles, which is a potentially lethal infection, especially in the context of malnutrition, which is also something Tim has just alluded to. So to me, it's really a question of what is being traded off against what when we're looking at COVID infection prevention and spread of the pandemic versus essential services for women and children. So I work primarily in West Africa, and our own group has, for example, mapped out the consequences of vaccination services not being delivered even without the presence of a pandemic. And we already show that there's a plateau of about 80% of vaccination, and that is not enough for herd immunity for diseases, for example, like measles, that need to have a cover of up to 95% in the community to prevent outbreaks. And just to give a recent example, during the Ebola outbreak in the DRC, about 3 times as many people died from measles as did end up dying from Ebola. So the consequences of not vaccinating and providing the essential services in the immunization programs are really, really rather devastating.
And Dr. Kampmann, if you could also talk about the fact that you've said that the effects of diminishing or entirely preventing people from getting vaccinations, that the effects will only be known in a year or two, not immediately, and what you think needs to be done or can be done to ensure that vaccinations continue despite this pandemic.
Yeah, so it depends slightly on the level of vaccine coverage that the individual countries have, and it also depends on the diseases that we're trying to prevent. So measles is a highly infectious disease that needs 95% of the community to be immune to protect the individual, but also to stop transmission in the community. There's meningitis, there's pneumonia, there's diarrhea. All of those are vaccine preventable and are amongst the most common causes for childhood morbidity and mortality, especially in children under the age of 5. So the solutions to consider in a situation where healthcare workers might feel exposed if they run vaccination campaigns, or parents might feel reluctant to go to immunization clinics. And we're seeing this in the UK as well. We need to really, first and foremost, have a commitment that the delivery of vaccines to populations remains a high priority for health services. Then we can possibly break down the interventions that could be done into some of them being purely logistical. For example, flights are suspended all across the globe, and flights bring vaccine supplies to countries. And maybe extra flights need to be chartered to bring vaccines to countries. And for example, in the Gambia, we've already run out of oral polio vaccine for one reason or another, and that's already shown a bottleneck. When it comes to healthcare workers and the public, obviously the the personal protective equipment needs to be available to healthcare workers. People need to respect good hand hygiene, and we need to probably run the clinics in a slightly different way, stagger appointments so not everybody turns up at the same time, and maybe more frequent clinics in different smaller places. The third intervention, I think, is crucial, that we have data collection tools that will allow us to capture what is going on in the immunization system, who has received vaccines and who hasn't, because it's not just now that the children and anyone in the community will suffer from preventable infectious diseases. It's in a little while when the herd immunity or the community immunity has either dropped, or there are new birth cohorts of children who then, because of suspension of immunization programs, would have never seen a vaccine. And the health systems need to put in place records for that to be feasible, and the data collection systems really need to be fit for purpose. And we really probably need to think about new models of delivering vaccines and to have more platforms, and maybe not just restricting them to the usual EPI clinics. For example, antenatal services play a big role in maternal immunization.
And Dr. Tim Robertson, the response of governments to your report, I mean, it is a deeply alarming report. The number of children who will die in the next 6 months around the world, not to mention mothers.
Since we published the report, we've had a lot of countries reaching out to us, country officers of NGOs working in different countries around the world, and even ministries of health themselves contacting us and saying, you know, we really appreciate this study because we are actually starting to see this play out in our country, and we're worried about it. And over the next few months, our goal is to do more of our own kind of modeling and analysis, working with countries themselves to use their own assumptions around what they think is happening in their country based on available data, as Dr. Kaplan said, and also then model different potential scenarios that they could put in place, different policy options that they can, so that they can mitigate the spread and transmission of COVID.
Dr. Robertson, let me ask a quick question.
To maintain care.
The significance of President Trump saying that the U.S. is going to pull out of the World Health Organization and the overall stopping of funding to it, the role the WHO plays in children and maternal mortality and health.
Absolutely. I mean, the WHO plays a crucial role for maternal and child health around the world. It's a vital mechanism for coordinating work in the global health space. Also, I think what people don't realize is the technical assistance that WHO provides to different governments and ministries of health around the world. And right now, countries are looking for guidance about how they can do this, what sort of policy options they should be considering, what sort of action they can take. And WHO has been putting out guidance now, operational guidance on how countries can maintain these maternal and child health services, you know, while also addressing COVID. So I think to undermine WHO now or to defund it, I think would be highly counterproductive.
And Tim, could you also very quickly before we conclude talk about some of the concerns you've raised about disruptions both in food supplies as well as the disruptions to pharmaceutical and medicine supplies in the areas in which you're most concerned? And
we have 20 seconds.
Mm-hmm. Yeah, so this is, I think, perhaps often overlooked, but is an absolutely kind of vital thing to be considered. I mean, health systems are complex, and so we're not really sure how these secondary effects play out. But I think governments can make sure that they have social safety nets for people who are suffering food insecurity and kind of bolster and perhaps may need to expand some of these social protection programs to make sure that children aren't at risk.
We want to thank you both so much for joining us. Doctors Tim Robertson of the Johns Hopkins Bloomberg School of Public Health will link to your report, and Dr. Beate Kampmann, infectious disease pediatrician and director of the Vaccine Center at London School of Hygiene and Tropical Medicine. That does it for our show. Very happy birthday to Taymori A Studio. I'm Amy Goodman with Nermeen Shea. Thanks for joining us.